Does the BMI need to be 25 or less to do a mummy makeover? I don't know where you got that from. That sounds like an NHS thing, to be honest. 25 BMI, because that used to be the criteria in the NHS when I was in the NHS. But I think nowadays there's not even a criteria, is it? I don't know if they'll entertain it in the NHS. But anyway, BMI 25 on paper is normal weight. But in reality, not many people have got a BMI less than 25, and certainly even fewer people who need a mummy makeover have got a BMI less than 25. So, in my view, a BMI less than 25 is unrealistic for someone who's thinking of having a mummy makeover, and I would not insist on a BMI under 25. Um, what I tend to work on, and what a lot of people work on, is a BMI of 30. Now, a BMI of 30 strictly is overweight. 25 to 30 is overweight, so you're still overweight. But it is, when they've done studies on it, they have found that your risk of complications is less if your BMI is less than 30. Now, they take people they use the cutoff of 30, and they find a group of people with a BMI above 30, a group of people with BMI below 30, who have whatever it is, tummy tuck, mummy makeover, whatever, and they say your complication rate is less if your BMI is below 30. So as a ballpark, as a guide, I would say 30, not 25. I would say 30 is a sort of healthy, if you like. I mean, okay, on paper it's still overweight, but it's, let's face it, not many people got BMI less than 25. I don't think I have. 30 is sort of where I would be going with for health and complication reasons for the surgery. So from a purely medical point of view, but two things. Number one is obviously there's the absolute value of the BMI. So if your BMI is less than 30, it's better than if your BMI is above 30. But the other thing is it's got to be stable. That's really important. Your BMI's got to be stable. So you want to get to a weight that is realistic and that you feel comfortable with, because un if you sort of falsely get to a low BMI just to have the surgery and then you put the weight back on again, that's no good. Similarly, if we say, oh, 30 is the thing, so you get your BMI to 29 and have the surgery, but actually you wanted the BMI of 26 is where you'd be comfortable, you're better off having the surgery when your BMI 26. So it's where you're comfortable and stable. If you want to lose weight or put on weight, no matter what your BMI is, you're better off doing that before surgery rather than afterwards. So even if your BMI is 29, if you want to lose weight, do it first. Just because we said, oh, your BMI is below 30, you can have surgery now, you'll get a better result if your weight is stable. So you'll get less complications the lower your BMI is, but you don't want to have weight fluctuations after surgery. If you put on weight after surgery, you can stretch the skin. The worst thing you can do is putting on and losing weight. Because as I say, if your BMI is 29, you have the tummy tuck, and then you go down to a BMI 26, there might be some redundant skin left there, which we could have tightened if we'd done it when your BMI was 26. So you're better off being stable with your weight, ideally with a BMI less than 30. One of the beauties of the private sector is we're not held by strict guidelines like, the NHS, like BMI got to be 25 or whatever. It's not strict, but nevertheless, we've got to do the right thing for you. We've got to explain to you why the BMI is an issue, and the complication is higher than a BMI over 30. And I have operated on people with BMI over 30, usually people who've lost a huge amount of weight. So people who've gone from BMI of 45 to 35 or 33 or something like that. Often these people, it's unrealistic to get a BMI of 30, and they're just never going to get there. So you either say, look, you're never going to have surgery, or you say, look, you've got a higher risk of complications. You'd be better off getting your weight down, but if you can't, you could have surgery now, but you've got a high risk of complications, and they can balance that out and decide in their own mind whether it's worth taking on the risks of having more surgery with a higher BMI. So, good question.